Hi there, I'm a urologist and pelvic surgeon. And if you're new here, I make urologic content every Monday and Friday. So if you enjoy watching this, please share this channel with your friends. I get asked all the time, do women really masturbate? And it's actually a really great question because in medicine, we're always taught about male anatomy and how men have prostates and seminal vesicles and ejaculate. But when it comes to female anatomy, we don't learn that much. In fact, I had no idea what any of these female anatomy were called until I went to my OB/GYN rotation in residency. So today I'm going to talk about female anatomy and specifically what happens during masturbation in women. If you want to watch a video about male masturbation, I made one previously. And if you want to watch both of them back to back, they'll be linked down below. During masturbation, men usually achieve climax through either stroking the penis or through clitoral stimulation in women. Climax can be achieved through clitoral stimulation, but also through vaginal stimulation. First off, let's talk about the clitoris. The clitoris is an erectile tissue that is located at the top of the vulva or the top of the labia. It looks like this and wraps around the urethral opening and the vaginal opening. This is the hood of the clitoris. This part is called the prepuce. Some people are born with a prepuce that covers the clitoris, and some people have a prepuce that is fused to the top of the clitoris. When you look at the actual gland of the clitoris itself, it has a large number of nerve endings and blood vessels that when aroused fills with blood and becomes erect. You can see exactly how this would stimulate the woman during intercourse or masturbation. The other area that is important to understand is the G-spot. You may have heard of the G-spot. It was discovered by Ernst Grafenberg in 1940. He described a very sensitive area on the top of the vagina that when stimulated caused orgasms. However, this is not a universally accepted finding. Some people feel that they do have a G-spot and others do not. There are multiple theories about where the G-spot is. It could be right underneath the top of the vagina, or it could be in the anterior vaginal wall. So why does this cause orgasms? Well, there are two theories. One theory is that there are a lot of nerve fibers that go from the G-spot to the spinal cord, and when stimulated, causes a reflex response that results in orgasm. The other theory is that there are lots of receptors in the vaginal wall that sense stretch, and when they are stretched, it results in orgasm. Interestingly, when looking at studies about whether women masturbate, they found that only about half of the women who participated in the study reported ever masturbating. However, in reality, we know that about 80% of women do masturbate. Why is that? Well, there's a huge difference between admitting to something like masturbating versus actually doing it. And many women feel embarrassed or ashamed about masturbating, and therefore don't want to admit to it. In another study looking at women over the age of 70, almost half of them admitted to masturbating in the last year. Another study looked at nearly 2,000 women of varying ages from the United States and Australia, and they found that about 3/4 of the women in the study did masturbate. Of those, they were most likely to use their hands or fingers, and less commonly they used objects or sex toys. About 1/4 of them reported never masturbating, and interestingly, the reason for not masturbating was due to lack of pleasure or satisfaction or discomfort. But what actually happens during female orgasm? In order for a woman to achieve orgasm, there are 4 phases. These are similar to what we talked about in the male orgasm video. They are the excitement phase, the plateau phase, the orgasmic phase, and the resolution phase. During the excitement phase, women will often experience swelling of the labia or the lips of the vagina and the clitoris. The vaginal walls start to become thicker and longer, and the vagina itself starts to become wider. Then the body goes into the plateau phase where breathing becomes faster, heart rate increases, muscles tense and then relax, and blood flows to the genitals. Once the plateau phase is reached, the body then enters the orgasmic phase. During this time, women typically experience rhythmic contractions of the pelvic muscles. These are very similar to what we call the P-spot or the Grafenberg spot that we talked about earlier. And these contractions can be felt anywhere from the vaginal entrance to the upper part of the vagina. And interestingly, these sensations are perceived as pleasurable, especially if you've watched my previous video on female ejaculation. You might be wondering, do women ejaculate? And the answer is yes, they do. In fact, about 2/3 of women do ejaculate. They just don't ejaculate as much as men. Female ejaculate is different from male ejaculate. It is a clear fluid that comes from the Skene's gland. What's that? I'm glad you asked. The Skene's gland is a gland that is located underneath the urethra in women, just like the prostate is located underneath the urethra in men. And while it is quite small, it can be identified in 90% of women at autopsy. Interestingly, it is believed that women who experience orgasms more frequently have larger Skene's glands. Now, what about self-masturbating and having an orgasm? Is there any difference? Well, in one study, they looked at women who were brought into a hospital and they measured their heart rates and their blood pressures. They wanted to see what happened during orgasm, and they looked at two groups of women. One group was women who had achieved orgasm through intercourse, and the other group was women who had achieved orgasm through masturbation. And they found that women who achieved orgasm through masturbation had higher heart rates and blood pressure changes than those who achieved orgasm through intercourse. And finally, is there any health benefit to masturbation? Well, some studies have shown that frequent masturbators tend to have lower blood pressure. And this is probably due to the fact that during climax, there is a release of endorphins, which are natural pain-relieving chemicals in our body. And as I discussed in my previous video, having regular ejaculations reduces your risk of prostate cancer. We don't have any data on women who masturbate and their risk of cancer, but it's probably true that releasing those endorphins helps you overall with stress reduction and therefore probably overall health. Bottom line, ladies, masturbation is good for you. If you enjoyed this video, please make sure to share it with your friends. As always, remember to take care of yourself because you're worth it.